Good afternoon, everyone, and welcome to today's Medtech32 webinar session. You will all be on mute because we've got 190 people registered for this session. Currently, we have 66 people attending, and that number's growing. So I know many of you will be from multiple people from a single practice. So welcome. So today's session will be covering the concepts of query building. So we're not going to go into any depth, particularly on individual people's queries that you may have or would wish to discuss today, simply because there isn't time. What we would like you to do is at the end of the session, if you do have specific queries that you're struggling with, they may be quite complex queries, ask us to contact you in the question session. Just put please contact me. If you want to leave your phone number, that's fine, but we will have your email address that we registered with you, and over the next few days we will get in touch with you and discuss with you your individual struggles that you might be having with the query builder. So today we're going to look at how you build a query. So it's going to be very specific for people who've never used the query builder before, people who have used it a little bit but don't really know much about it and have perhaps taught themselves. And if we've got any advanced users online, you may pick up some tips and tricks, and we will look at doing an advanced session on a later date. But that's something you could put in the feedback if you would like some advanced sessions on the query builder. We could look at doing those in another date, and you'll get a feedback form from us after the session. So that's something you could note if that's something you think you would like. So before we jump into the query builder, I just want to show you that for those people who are registered with our Insight customer portal, we have a lot of webinar query builders already available for you to pick up and download, and those ones you can play around with and test and see if they meet your needs, so you don't have to think about them yourselves. So if you go into the Insight portal and go to downloads, oops, sign in again, and to the Medtech resources, scroll down to the very bottom. Just move this out of the way. Scroll right down to the bottom of this page, and you will see here you've got a whole list, you've got two lists in fact, of various different types of query builders that have already been built. These can be downloaded. So all you need to do this on the server. As you can see here, the installation needs to be run on the server. So you might need to get your cloud installation team to do this for you. But if we click on a query, it will download. Oops, this thing keeps getting in the way. And you can save it and run it. I'm not going to do that now, but it's very straightforward. Just answer the questions that you're asked, and that will install the query builder into your set of queries. Also on our Insight portal, if we just come back up, go back a page, and to the Medtech32, just get my little thing out of the way, Medtech32 training guides. There is also a training guide here under the specialty guides. Oops, just here, Medtech32 Query Builder, and this will cover pretty much everything we're going to discuss today, or I'm going to demonstrate today. So this can be downloaded and you can distribute it amongst all your staff that are interested in the Query Builder. So just thought I'd get those two little things out of the way to start with, and then we can start. Now, obviously, the first thing we need to know about query building is how to access it and where to access it from. So Query Builder lives in the Tools menu here. Query Builder this is where we can access it from. Also, you can access it from your toolbar if you put the icon on your toolbar. So I presume you all know how to put icons on your toolbar. So If you don't have it, it will be in this list here of the non-selected tools. Just use the arrow, highlight it, use the arrow to put it into your selected tools, and then you'll have it on your toolbar here. Now, if you click on the, if you select the Query Builder icon and it comes up with a message that says, sorry, you do not have permission to access this. This is something that's internal to your practice. So you just need to speak to the person who manages your database and has access to the setup, and they can arrange for you to have access to the Query Builder should it be appropriate. So once we open it, so when you open up the Query Builder, you get presented with this box here. And what does it all mean? So for somebody who's never used it before, it can look quite confusing and quite daunting. So we're going to explain what all these little boxes do and what they're for. So the first box is called the table box. That's this one here. It's called table. And all databases are created using tables. So every screen that you see in Medtech is an individual table within the database. So we open up the drop-down box here, and it will show us all the tables that you have access to. So you can see there's many of them. You can get queries and reports from most areas of Medtech. There are a few areas that we can't query, but in general sense, most screens that you have access to, you can pull Query Builder reports from them. Within the table, so if I select the top table, which is called the patient table, if I select that table, within the table are many fields. So we're now looking at the fields within the patient table. And again, you have many, many selections in here. So these are the list goes on and on. Now in the patient table, all the fields relate to a field within the patient register. So if I bring up the patient register and come up the Query Builder again, all of these fields in here relate to a field in the register, every single one of them. So if we start at the top, we have the patient's surname, which is found in this field here, and so on and so forth. So that's what the fields mean. If you're looking for information, a report on prescriptions, for instance, you won't find the information that you're looking for in the patient table, because the patient table only relates to the F3 screen. So you would need to open the table that relates to the information that you're looking for. So if you're looking for prescription information, you will find it in the table called prescriptions. So that sort of covers off a little bit about the tables. The where column, this is where you build your query. This is where you ask the Query Builder the question that you want to know. How many patients do I have? How many patients do I have that are female? How many patients do I have that have diabetes as a classification? This is where you ask the question. So we'll go through and do some queries in a second. The bottom box is the select box. That's this one here. This is your output. What do you want to know from the information that you've asked? So you may have asked, find me all the registered patients who are female. What do you want to know about those female patients? Do you want to know their name, their address, their date of birth, their NHI number? So this is the information that you put in this bottom box here. What you want to see basically on the piece of paper that prints out at the end of your query building. You've got these columns here with lots of arrows. They're quite straightforward to use. So if I was to choose a field that I want to put into my query, I want to find all my registered patients, for instance. I can put that in here using the arrow that pushes it across. If I've put it in by mistake and I don't need it, I can use the back arrow to take it out again. The C I'll cover with you in a second. And whatever order you put your fields into the query, I apologize for my dog barking. My husband was supposed to keep him quiet. You can then order your query in the order that you want to see it, and we'll cover what the order should be also in a little while. The same is for the bottom box. So if you want to put a field in here, that one won't work. You can use the arrow to put it in, and you can use the other arrow to take it out, and you can order them. This little tick box here says build the query in the order specified as above. Now, if you're looking, say, for registered patients, and you're looking for maybe just female patients, pop that one in. When you build your query, if you put the widest search in first, it will take a lot longer for you to get a result, and particularly for those medtech practices where speed has become an issue, the larger practices. It is quite important to build your queries in the most efficient way. So for instance, if I built my query like this and said, go find all the registered patients, and then out of all those registered patients, I just want female patients, that would be the wrong way round, because that will take the longest time. So if I move this up and says, go and find all the female patients first, then out of those, I just want all the registered patients. That is a more efficient way of building your query. So you look for the shortest shortcut first, and then expand that out into the wider searches. And because some of the queries that you build might be quite complex, and as I said, for Medtech32 practices, speed may have become an issue, try and run your queries at a time when there's not too much traffic going through your database. A quieter time is best for running big queries. And also in the bottom box, if I've, for instance, put the surname in here and the first name, if I put a tick in here, it will alphabeticize my query in alphabetical order, starting with A. If I put this at first, it will order the first names alphabetically and your surnames not. So again, you need to decide how you want your query to present, and you can use these tick boxes as you see fit. And over here we have some buttons. So this is the query store. And this is where your queries are saved, because you don't want to have to rebuild the query from scratch each time you got one. Once you've got a good one, you want to save it so that you can reuse it again, and also so other people in the practice can use it as well. So in here, once I've built a query, I can come into File and select Save the Query. And when you select that, you give it a name, and let's call it a test for now, and OK. I can overwrite an old query that has the same name. You may have updated a query that you've already got, in which case it's very good to overwrite it so that you don't have two copies of the same query. If you say no, you don't want to overwrite it, you will need to change the title. So you could call it test 2, and that would be fine. The other things you can do in the query store is you can create folders for your queries. So if I set up a new folder, I would give it a name. And then I can save my queries into this folder. I've already got one called My Queries down here, one I prepared earlier. So I can save my queries into my folder. Little word of warning though, if you are going to be moving to Evolution in the near future, don't spend a lot of time putting queries into folders, because whilst your queries will export over to Evolution quite happily. You won't lose any of your queries if you do convert, but you will lose your folders, unfortunately. You can export and import queries, which I will cover in a little while. So and you can delete your queries. So if you have a query list that is very, very long and very, very old, it does need housekeeping from time to time. So it is a good idea to go through and find the ones that you want to keep and get rid of the old ones that are just sitting there because they cause a lot of confusion sometimes. These are something you can actually delete. So they've gone forever. They're not inactivated. Run the query. This is when you've built your query and you want to have a look at what the results are that have come out of your query. So if I just select a query here that I've prepared earlier and then I run it, this is the output. This is the result of my query. We don't need to worry too much. It was a very basic query that said, find me all the registered patients who are female, who are older than 65. And I want to know their name and their age and their gender. So when I run this query, it's given me their first name, surname, their age, and their gender. SMS queries. This is to run a specific query to send out SMS text messages. So you need to be using the Medtech SMS service, not Venza, to do this. Venza have their own method of running queries to send text messages out. So if you're registered with Medtech's SMS service, then you can send text messages from your query. So you can pull out a report on a group of patients and then send them all a text message. I don't believe I will have time to show you this in this session, but I will be covering it in next week's webinar on SMS. So we'll be covering the SMS functionality, and I'll include the SMS queries in that. I tested my my webinar this morning and it ran over by quite a while, so I had to cut some things out. So one of those was the SMS, because as I said, we are doing SMS next week. View SQL, you don't need to worry about this unless you've been to university and studied sequential query language, which is what SQL stands for. Many people ask what that means, and it's called sequential query language. And it's what database administrators are taught at university. So if you have a look at it, this is what it looks like. This is the language that the query has been built in. So what we've done is we've given you a nice English interface here, but behind the scenes, that English interface gets converted into the sequential query language that is required to actually give you a result from your query. But you don't need to worry about that. And then once we've run our query, we have a data sheet view, which is the tab that's up here. So I've already run this query, so I have a data sheet view. Oh, no, I don't. We'll run it again. And this is the data sheet view. And in here are some buttons also that can be used. So obviously you've got a print, so you need to select the printer you want to print to, and then you can print this report. You can also export the report into an Excel spreadsheet, which can be useful from time to time to be able to do this. You can then manipulate your data, you can remove duplicates, you can use all the whistles and bells and graphs and reporting that Excel can offer. And so if you want to export your query into an Excel spreadsheet, you save it to disk and find somewhere on your desktop in your documents folder to save your query, and it will save as a .csv file. And what that means is that type of file can be opened up in Excel. So if you have access to Excel, all you need to do is click on that file wherever you've saved it, and it will open it up in your copy of Excel. And again, in a more advanced session, we could look at exactly how to do that and look at some of the tools within Excel that can be used to manage your data. You can also merge your query. So you can merge into documents, patient's next visit, patients' recalls, and an alert. So I'll cover those with you shortly when we've actually been through and built a few queries. And if we were running an SMS query, then this button would be a light. And you've also got an up arrow here, which allows you to bring the patient within your query up onto the palette. Now, there's one little trick that you need to do to make that happen, which is why the arrow is currently grayed out, and I will show you what that is. So let's go back to the designer view, and we will start with a new query. So we'll do a simple one to start with, and I'll show you some of the tips and tricks that you'll need to build a good query. So let's say we want to find all our registered patients to start with. So we will need to find that in our table list. And there's our registered patients. And we'll put that across here. Now it's going to tell me that the condition is undefined. And what that means is that in some of our fields, not all of them, but in some of them, there are values within the field. So what a value is, say, for instance, we'll look in the registered field here. Within this drop down, there are some other options, and these are called values. Likewise, what we have done is we've asked the query builder to look at registered patients, but we haven't specified which value within that drop-down list we want the query to extract. So we can double click on this to open it up, or we can click on the C here in the middle here, and that will do the same thing. So the condition that we're looking at by default is equal to, and the value that we are going to select is registered. So this is the same list that is in your registered field on your patient register. So we can select this. But what if we want to look at registered and casual patients? Would we have to run two queries to do that? And no, we don't. Because if we change the condition from equal, we can change it to in. What this allows us to do is to select a number of those options of those values within that list. So I can choose registered and casual. Another option would be not in, and that gives us the reverse, the flip side. So if I choose not in, then I will get information on my deceased, not registered, registered other, transferred, and visitor, but it will exclude the casual and registered. If I choose the selection to be is blank, then that will pick up everything in the registered, in the values, all the registered values. Sorry, that will not choose anyone. Beg your pardon, I've got that round the wrong way. This will not choose anyone. Your query will be blank because this field, this registered field, cannot be blank. Your ethnicity fields can be blank, and your WINS numbers can be blank, and your country can be blank, but your registered field cannot be blank. Whenever you bring up a new patient to enter a new patient into the patient register, that field will always have a default option in it. If I delete it and take it out altogether, you are not able to save. It must have an entry. So if I put is blank into this option for the registered table, it will not give me any information whatsoever. If I choose is not blank, this is the one that will give us everyone, all registered patients. So there's two choices I could make here. One is I could choose is not blank. The other is I could choose equal to registered. So if I choose equal to registered, it will just give me registered, and is not blank will give me everyone. So you do need to have some understanding of how these tables and the fields and the values work together to give you the exact result that you're looking for. Query building is not intuitive by any level whatsoever. It will give you exactly what you ask for. And in 30 years of working with the Query Builder, I have never found a query that doesn't work except for one occasion when there was a bug in the software. It's always the way the question is framed, and that's your biggest challenge when you're building queries, to ensure that you frame the question the right way. So let's go back to here, because we're going to for this query, I'm just going to choose registered patients. And then I might want just those patients of a particular age, so I can start adding fields into my query, and this is what's called building your query. So let's select gender, for instance. So I just want my female patients. And again, you'll get the same options within here. So I could look at female and male, but leave out unknown, and so on and so forth. So this concept is the same. I would choose equal to female. And then we might just so look at their ethnicity code. No, we won't. We'll look at age range. And here we get a different selection of conditions. So our conditions can be between two ages. So we could say between 5 and 15. Those are the people I want to look at. Or I might want to look at people whose age is less than 5 or 10, whatever, or greater than, or equal or greater than, or equal or greater or less than. And again, you have the is blank or is not blank. So let's choose greater or equal to 65. And okay. So there's my question. So I've chosen a fairly simple query, and I've only selected fields from the same table. That doesn't mean to say that I can't cross over and pull information or ask questions from other tables as well. So for instance, I might want to know what their of my female patients who are greater than 65, I might want to know what their latest HbA1c measurement is. So in that case, I would need to add the date of measurement. If I don't put a date in, it will tell you that you must have one. So when you're looking at these clinical queries, you will need to add a date. So again, we define the condition. And in this case, you might want to look at two specific dates. So this is the date that the measurement or the screening code was added to the database. To make it less complicated, so you don't have to do a lot of maths, you could look at dates at screening codes or measurements, HbA1cs, that have come in from a particular date or to a particular date. Like everybody, if I chose 2 today, that will pick up every single HbA1c I've ever done on my female patients who are registered. But if I pick up from, then I could perhaps put in last week or last month, and that will pick up a much smaller range of patients. Or I could select is not blank or is blank, and again, I will get exactly what I've asked for. So I don't know what I've got in this database, so let's choose 2 today. So I'm going to pick up everything. And then I'm going to select my screening code. And again, we've got equal to, and then we select the value. And this is these are all the values within the screening terms. So, okay, so I don't have an HbA1c, so I'll choose, might actually just choose, because this is a good choice here, is choose blood pressure. Now with blood pressure, you've got two measurement values. You've got a systolic and a diastolic. So you need to add either or both of those into the query as well. So we're going to add the measurement value in here, and I'm going to select both the systolic and the diastolic. Okay, so that's my query. It's going to look at all my female patients who have had a blood pressure ever, and but only for those that are over 65 years old. So what do I want to know about these patients? If I start putting names into then this is what was called a list query. So it will give you a list of patients. So the first thing I'm going to do is choose a surname and a first name. Now I've chosen surname and first name instead of adding a full name. This is because I can alphabetize my list by surname. That just makes it easier for me to read. You don't have to. You can put it in this way. You can put it in without alphabet. But if you put in the full name instead, what it will do is it will sort it by title. So you'll have your Misters, Mrs., Masters, and what have you, whatever else, doctors. The doctors will be at the top because they're D. It will sort your list out by title, and that's not particularly what I want to see, so I would leave out the full name and go for surname and first name. And then you can start adding whatever you want into here. So I'm going to put in measurements, and I'm going to put in the measurement value because I want to know what the systolic and the diastolic blood pressure is for these patients. So I'm going to put that into my outbox, and I might want to know their NHI number, so I could put that in as well. So I'd need to go back to the patient table and look for the NHI number and pop that in. So when I've added all the information I want, there is a limit. You can't keep on adding fields into this section here because you can only add as much as what will print out on an A4 piece of paper. Otherwise, it will tell you you have too many columns. So this is the list query, and I'm going to run it now. And what have I missed out? Equal to, what have I missed here? Change that to, it's not blank. Whoops, wrong one. And same with this one. Okay, so there's my patients. Now it's giving me, as you can see, a lot of duplicates because I have a lot of patients who have had multiple blood pressures taken over the period of time that I selected. So had I selected a narrower field of time, then I wouldn't get as many duplicates. So if you don't want to see the duplicates, you can add in a field called the count function. And so if we look in the table selection and right down the very bottom, you've got a field called count function. And by adding that into the bottom and rerunning your query, you will see that a lot of the duplicates have now moved over here. So Catherine Atkins has had her blood pressure of 120/90 added into the database 25 times. She's also had some other measurements added, so they would add in also as duplicates to her name, but they're not duplicates in such as they are different values. Okay. Now managing a query like this, you with a lot of duplication and a lot of information that is perhaps extra to what you want, it then makes a lot of sense to move this query into an Excel spreadsheet because then you have the ability to sort it take out your duplicates, leave you with the data that you exactly want. Once you become an experienced or an advanced user of the Query Builder, you can put the measurements in to be more specific. So you might want to just look at patients who have a blood pressure of 120/90, or people with a high outcome. And I say we'll cover those very details later in the advanced session of the Query Builder. So that's a list question or a list query. Now, sometimes you just want to know how many. So what I'm going to do is go to the query store and pick up one that I prepared earlier. And this is a count query. So I just want to know how many. Now I've chosen a classification query on purpose because I'm going to hopefully explain why people run into trouble with classification queries, because they can be very confusing. But with a little bit of knowledge and a few extra buttons up your sleeve, you will be able to build quite good classification queries. So this one is a date up until today for all patients who have a read code within diabetes. And I just want to count them. So when I run this query, it tells me I have 8 patients who have diabetes. But hopefully you're all saying, no, you don't. That's not right. You don't have 8 patients. You probably have a lot less than 8 patients, and you're quite correct. I do have a lot fewer. I do have fewer than 8 patients who have had a classification of diabetes. So if I add patient's name into here, and run it again. Oh, so that's a good one. I was going to show you that anyway. This is an error message that comes up, which confuses a lot of people and often prevents them from continuing with their query building journey. It's actually quite a simple error message that can be easily dealt with. It's not in very good plain English, but once you understand what it does, if I go OK, all it means is this field, this count function field, must be at the bottom. It can't be anywhere else. And if you leave it anywhere else, if I even bring it up one field higher, it will bring up that message. But if you order it to the bottom of the list and run it, you won't get it anymore. So you can now see that I've got 1, 2, 3, 4, 5 patients with diabetes because Arnold Smithy has been counted 4 times. Now, why has he been counted 4 times? With knowledge is power, and if you know why he's been counted 4 times, then you can avoid this situation from happening. And the reason he's been added 4 times, if we look in, there's a couple of reasons why he's been added 4 times. If we look in the classifications table, and look at his read code description and pop that into the query. One of the reasons is because whilst he's got 3 classifications for diabetes, he's also got a classification for insulin-dependent diabetes, which is a lower code number, which is C108, I think. Whereas diabetes is C110. So it's in the same branch of read codes. So read codes are indexed in branches, and the more specific the read code is, the lower it is in the branch. So Arnold at some point in time was diagnosed with diabetes mellitus, which is C10, but he was also diagnosed with IDIM, which is C108. So if we go and have a look at his classification table, let's open that up, you will see here, 25th of May, he's had a classification for diabetes. 2016, he had another one. And in 2015, he had another one here. So that's why there's 3 instances of his diabetes. Also, you may not always see the all of them, because your classification list is often filtered to show you the most recent only. So when you look at it, you actually only see the last one that was created. But by looking in the filter and selecting show all, you will see all of the instances where Arnie had diabetes selected, or a new diagnosis of diabetes added. In a lot of practices, particularly these days, doctors and nurses classify each consultation. Some do, some don't. So if we go into a new consultation and I select diabetes here, and use the same icon as you would to repeat a medication. So you assign this ticked classification to this consultation, then tick it first. Right? Put a tick in it first and assign it. It will assign this classification to this consultation, and it will count it as an encounter. So each time a new classification is added, or a classification is assigned to a consultation, it is counted as an encounter. And when you are building classification queries, you are counting encounters. You are not counting patients who have a classification. So in order to get around this, so that you only count how many patients you have with a specific classification, you will need to, I mean, at the moment, I can count them 1, 2, 3, 4, 5, 6, 12, 1, 2, 3, 4, 5. I've got 5 patients with it, but that's not a real situation for you. You will have hundreds, if not thousands. So the best way to deal with this is to export it into Excel. And we can go save to disk. You can save this into your desktop and open it up later. And I have one I did earlier just to show you that it is quite easy. Just save it wherever you can find it. If I minimize some of my screens, I've put it in here. I've saved it. Here's my diabetes count. So this is what it will look like when you save it, and when you double click on it, it will open up into an Excel data sheet. And here you can take out the duplications that you don't want, and you can use your counter down the side to count how many patients you actually have with diabetes. And that is about the easiest way to do that. As I say, I know it's one that a lot of people struggle with. Okay. So the next one we're going to look at is merging, and what you need to make a patient be able to pop up onto your palette from the query builder. So to do that, you will need a specific field in your query called ID for merge. So it's in the patient table, and we come down to ID is here for ID for merge. You can use this. We're going to look at list queries anyway, so we can take the count function out. You can use this whenever you want to. It doesn't affect the query that you're building. What it does is when I run the query, and it will put in a column here with these random looking numbers. And this is the patient's internal ID number. You'll find the internal ID number on the patient register. It's on the audit tab. Every patient has one, and these are used. They're used by our conversion engineers when we do database conversion. And they're used in the back end to uniquely identify every single patient in the database. But from a practice user point of view, you don't use them. So by putting the ID for merge in to your query, it will make this button here light up. and then you can put your patient onto the pallet. So if we choose Mr. Mouse here, you can now use your query builder as a dynamic query builder. And come on. And now Mr. Mouse is now on the pallet instead of the patient I had before. So yeah, so that's how you do it. Make sure you've got your ID for merge in the output box below. The other thing that the ID for merge allows you to do is to send all your patients within your query builder a document, a letter. Probably not so much done these days, but it's still a very useful tool to have. So I've brought up a list of patients and I want to send them a document. So I can go to Mail, Merge, select the document from my list of document templates. So you need to have an outbox document template set up to do this, and select your printer. And you can decide if you want to add a copy of this letter into the patient's outbox and go, okay, and your letters will print. Simple as that. Very, very easy mail merge. The other options you've got in here is you can put a task onto your patient's next visit. So in here, I can add a task and type whatever I want in here as my task. This is a patient task and it won't be assigned to a specific provider. So it will just go into the F6 screen, and whoever sees the patient next will see a red heading on the patient tasks, and they will know that there is a task in there for them to look at. So that's how that's managed. We can add a recall, so you can bring up a group of patients and add a recall to that group. This one you need to be a little bit more cautious about because it can and has in the past messed up existing recalls if you're not particularly sure about what you're doing. So you would select what sort of recall it was, the recall code that you want to use. I'm just going to select something random here. A provider that you want to assign the recall to. You can spread the recall over a period of time. So it might be you don't want them all to end up on the 26th of May 2021. You want them all to be spread over a month. So you can select another date, and then you can update your existing recall for whatever recall you've chosen. Now this is again is where it gets a bit tricky if you are not 100% certain that this is what you want to do. When I'm training people, we cover this, I often mention it's a good idea to treat this the same way as you would giving an injection or tablets, that you get somebody else to just verify with you that this is exactly how the decision should be. Because these are difficult to undo. So when you're sure that you want to go ahead with it, press OK and the change will be made. Or if it's a new recall, the new recall will be added. And lastly, you can add an alert, but I just need to I needed to have put the alert into the query, so it won't actually do it, but it's just the same. You just add the query, add the alert into your group of patients. And as I said earlier, we'll cover the SMS later because we are going to get pushed for time otherwise. Now, that's sort of covered all the different functionality that the Query Builder has, except that what you can also do is export your queries to other people and import your queries from other people. So if we go into the query store, you might have built a really good query and your friend down the road who's not so skilled at building queries would love to have that query as well. I know some people take screenshots and send them off in an email. That's one way of doing it, but you can export your special query to a group of people or to another person. So select the query that you want to send and go into the query store and export your query. Save it to your place where you will find it. I did one earlier, but okay, we'll do this one, save it, and it will save as a QBU file. You see here, .qbu. So I'll put it in my folder so I know where I can find it. This is a good point. You can't have these chevrons whenever you, this is the same for saving any document, you can't use these symbols. So I'll just choose a query that doesn't have a symbol, or I would take it out and change the name of my query. So export query, and I will save it. Here's one I did earlier, graph test QBU. I can do this one as well and save it. It's now saved, and I can cancel that. I'll just go back to my desktop and open that folder, and there it is, QBU file. I can then open my Outlook and attach this as an attachment. So I go just send it to as an ordinary email with an attachment. Just remember, you're not sending any data, you're only sending the structure of the query to somewhere else. There's no data that's going to go with this query. Then when the person receives it, or if you receive a query, it's the same in reverse. So if I go to the query store and file and import a query, I will go to where I've saved it. So it's come in via email as an attachment. I will save the attachment, and then I will go and find it and open it. And I've already got this one in here, open it, and it will come into the query builder and come straight into the list of stored queries, and you'll be able to use it. This is really good if you get a notice. Sometimes some of the PHOs send notices out, please build this query and send it. Well, you can actually ask them to build the query themselves and send you the actual query, and then then everybody knows they've got exactly the same one. It might be something you discuss in a practice managers meeting that, somebody might say, I did that query, it's brilliant, it works fine, and everybody might say, oh, could we have it? Then you can send it to each other. So it's a really good thing to know what to do. While we're in here, you can delete your queries. As I said, housework from time to time. If you don't want a query, you can simply delete it. It will disappear. One little trick that I often talk about with my practices that I'm training is they've got a database of queries that's enormous, just so long, and just don't know what to do with it. Deleting them would take forever because you've got to open it up, have a look at it, decide whether you want to keep it or not, and then decide to delete it or not. And it can take forever to do that job. So what I've found works really well is if you send a message around to everybody to say, those people that use the query builder, go into the query builder and rename your queries and put your initials in front of them. So you can open a query up and save it, resave it, save the query and put in at the beginning your initials, CB, and go OK. Then everyone knows that's my query and nobody else is going to touch it. So you can say to the whole practice, go in, put your initials beside your favorite queries, and if after 2 weeks I'm going to delete all the queries that do not have an initial beside them, then that is a good motivation for everyone to get their queries sorted, and it will also give you the opportunity to delete all those that nobody has claimed ownership of. So hopefully that little tip might help. So we've just about reached the end, and I think in the few minutes that we've got left, I will have time to run that, to just pop through that SMS query for you. So I didn't think, because when I tested this morning, I actually did it in my head. I actually ran 20 minutes over time, but I seem to have managed to get through this quite in a good time frame. So we'll just have a quick look at the SMS queries as we have the ability to do that. So I've built a query, we're going to the query store, and called a text query. or an SMS query, whichever you like. So in my query, I need to have a field in here with the cell phone number, and I need to choose that it is not blank. This query is also in the user guide, so you can build it from there. And also this webinar will be is being recorded, and it will be going on to the Insight customer portal. So it will go into our webinar library and you can access it from there. I'll show you where the webinar library is as well. So the query would be cell phone. So you'd look down your patient table, because that's where your cell phones are kept, and pull in your cell phone and choose the condition as not blank. It's also a good idea to bring in the no SMS field from your patient table and is not ticked, so that you don't include patients who have decided that they don't want any text messages. And I'm just going to look at my registered patients. I'm not going to send this text out. This is a text I don't want to send out to casual patients or other types of patients. And then in the bottom box, you will need the ID for merge, and you will need the patient's phone number, cell phone number. Then instead of running the query as run query, you run it as an SMS query instead. Okay. And then before you can send this out, you need to right-click on the column that you've chosen your cell phone number. Oops, right-click and select this column as the mobile number. And then right-click again on these tick boxes. Right-click here and select all. Now, a few of mine have not got buttons, tick boxes, ticks in them. And that's because the cell phone number has got spaces. This cell phone number's got a space, and this cell phone number is an invalid number, and that's why they haven't ticked. But it will send a query out to all of the people who have got a tick in the tick box. So then I can go into SMS here and compose my query, and it will tell me that 23 SMSs will be created. And do I want to continue? Go yes. Okay, I know that. I'll just let go. And in here, I can now compose my SMS. So it's probably not going to let me, because I've got errors in here. So it's probably not going to let me do it. I will pick up the template. It's exactly the same compose a text message as in here. And you can compose your text message or use a template, and all your messages will go out in that one text. I'll make sure all my phone numbers are correct next time, and when I do it in next week's session, and so we'll see the SMS. I could probably, yeah. So that concludes my session on the basics of query building. So I hope you've got something out of it. Now, with questions, please feel free to ask questions. Put your questions in writing in the questions box. If you have done so already, have a look and see whether we have any. We don't have any. So if you would like to put questions that you may have in this, we will have over the next half an hour, we will have a number of panelists online as well as myself. So we've got our product manager, Chrissy Patterson, and we have one of our experts, Seema from Australia, who are part of our panel, as well as myself, and we are here over the next half an hour to answer your questions. If you've, as I said earlier, if your question is more around the specifics of a complex query, we would rather contact you directly and deal with that, because sometimes they take quite a bit of time to analyze and give you the answer to. So we can certainly answer some quick questions now. So feel free to type away and sorry, yes, it is on full screen. I'm sorry if I have a question here that the diagrams don't appear very big and they can't see the detail. I am sorry about that. When it goes on to the insight, you should be able to see it in a larger format if you're not able to see it now. I don't know why, because I can see everything in great detail on my screen, and I had assumed you'd be able to see everything that was on my screen as well. So I apologize for that. How do I find out? You will, if Belinda, who is also, I believe, on this call, will send out, I think she has sent out the invitations for next week's SMS webinar. If you contact, you can contact me probably at trainingnz@medtech global.com. So I'll give you that again, trainingnz@medtechglobal.com. If you just let me know that you haven't received the invite, I'll pass that on to Belinda and she will make sure that you get an invite to next week's SMS. Do we have any more questions? Thank you. That's great. You've got that, Stacey. That's great. What is the syntax for the condition where, what is the syntax for a condition where you don't get a list to tick? Do you separate it? No, you shouldn't be using syntaxes in your queries. That's for the sequential query language. So could you maybe ask that question a little differently if I'm missing it, but you shouldn't be using syntaxes yourself in building queries. But if you can give me a little bit more of an explanation of what you're looking for, I can see if I can answer it. Yes, Karen, we can catch up soon. Thank you for coming. Well, that's great. We had actually anticipated a lot of questions, so I'm hoping that because we haven't got too many, that we have done a good job in actually. Is there a zoom option for the screen? Yes, I apologize for that. I'm not sure how, I don't believe there is a zoom option, no, but so hopefully you'll be able to see it more clearly when you look at the recorded option. Hi, sorry for this. Can I give my email for future reference for queries? Okay, thank you. Yes, oh, sorry, you can access the webinars by going into the customer portal, and let's go back a step in here, and you've got Medtech32 webinars here. So if you click on the Medtech32 webinars section, once you get into Insight, then this will be your Medtech32 webinar library. So you have all the most commonly required, and the new webinars are listed first. So those are all here, all your ACC webinars. And then down underneath, there's many more webinars. And so there's an old Query Builder one here, which you can also have a look at. We will replace that webinar with this one once it's been edited and tidied up a bit by our team of magicians. But yes, these are all our webinars that we post online for you to view at a later date. And this one will go in. It will take a few days before it goes in, because I say it will be edited. Email is Robin, are you still you're still here? You're asking, maybe I haven't done what you did to get the list. Please show again. Can you just explain which list you are referring to? Somebody wanted to know the difference between the upper column, the where, and the select. Sure, yep, I can go over that again. So let's just bring that up. So the top box, which is called the where box, is where you ask your question. So if you think in terms of, what do I want to know? What am I asking the database to go and find me? I want to know all my registered patients, or I want to know who all my registered and casual patients. I want to know just my enrolled patients. I want to find just my patients who are female. And so this is where you're asking the question of what you need to know. And the bottom box is, what do you want to know about those people that you find? So your question may have been in the top, find me all the registered patients who are female, who are over 65. And in the bottom box, you put the fields that pertain to what you want to know about that question, about those people. So do you want to know their name? Do you want to know their address, their date of birth, their NHI number, their chart number, and so on and so forth? So those are the fields that you put in the select box. It's what you want to see on the piece of paper that you print out. I hope that explains it a bit better for you, or again for you. I love an advanced webinar, so we will look at doing an advanced webinar. I just wanted to ask what the difference on the Windows viewing. Yeah, so we've had on the Windows viewing full screen, the scroll wheel on the mouse makes the screen bigger or smaller. Thank you. I'll practice doing that. I apologize. I can't see what you see. I can only see what I see. So thank you for that question. I'll make sure that I scroll on the screen a bit better next time. So I think that's the list of values a field might have. Might be, yes, that's right. The list of values a field might have. Example, ethnicity might be NZ, European, Samoan. Yes, you're quite right. Was that a question, Robin? Can you maybe expand on it a bit more? Or maybe I can't see it all. Here we go. Yeah, so Robin, can you explain, what would you like to know about the values? Is there some more information I can give you about the values of a field? how did I get the list to select from the condition? Sure. Okay. So if I've selected, for instance, the registered, or you're talking about ethnicity, so let's look at ethnicity. So if we look at the ethnicity code, go and pop that into our where column, and then we're going to define the condition. We double click on it or select the C, and then the values are available in this empty box underneath. And these are the values that you want. So you can choose either equal to, in which case you can select one ethnicity or one value, as in this, or if you change the condition to in as opposed to equal, you can select multiple. So you can choose a number. So you would only use this if you wanted a few ethnicities as opposed to all of them. Because if you want all ethnicities and not just one ethnicity, then the condition would be, the condition would be is not blank. So as long as there is a field in, or there is a value in the field, it will give you all of the fields, all of the values. So choose is not blank for everything, equal for one, in for a few. And that's the general rule for those options. If you're looking for people who have not had their ethnicity entered, then is blank is a good option to use, because then you can find all the patients who have a blank ethnicity, and that might be something that you want to correct. I hope that answers your question. Yeah, the in option is an easy one to forget about. Yeah, so it's good to play around with it. And with query building, the only way that you will really get to grips with it and really understand it is to keep using it, keep building different queries, having a look, and then testing that the data that you have got is exactly what you want. There really is no shortcut to doing that. Is just keep building them, and you will then get the hang of it, to the point where somebody says to you, I need a report on this, 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 and this, and you can go straight to the query builder and within a few minutes give them the answer. And that is the place that I'm sure a few of you would like to get to, but it is practice. If you only do it once a month, then it is really difficult to learn all the millions and millions of different computations around building a query. So I think I've been through all the questions. As I said, you will get a feedback form, so please give good, frank feedback. If you want, if we've given you what you thought you were going to expect, then great. If you were expecting more or something different, then please give us that feedback, because we're happy to build more do more of these webinars. And because the query builder particularly is such a big topic, it's very difficult to get it all into one short webinar, and we don't want to hold people up for the whole of the day. So if there's no more questions, Seema, I think have you been looking at the questions? Have I missed any? All been done. Okay. Well, thank you very much for the remainder of you who are still online. I hope you've enjoyed it, and we'll look forward to seeing you next time. Thank you.